My name is Ernest Sternglass. I'm professor of radiological physics, Emeritus of the University of Pittsburgh School of Medicine. And I've been concerned about the effects of radiation on human health for many decades. As a matter of fact, it goes back to the first years when we built a house here in Pittsburgh, and we were asked whether or not, well, everyone was asked to build fallout shelters, and that's how I began to become concerned, because until then I was working mainly on X-rays and diagnostic radiology, trying to reduce the dose and get better pictures. But when I heard about fallout back in it was about 1960, 61, and I was here, president of the local chapter of the Federation of American Scientists, and so we all became concerned, will fallout shelters protect us from all this bomb fallout, or if there were an attack on Pittsburgh? And we looked at the recently declassified data on fallout, and we concluded, all of us, that there's no way to survive. Even if you survived miraculously in a bomb shelter, the entire environment would be contaminated. And that is how I began to realize that our government was not telling us the truth about the seriousness of low-level radiation exposures. Because at the same time, in 1960, 61, I found out about a paper by Dr. Alice Stewart in England that was reported at congressional hearings about the need for bomb shelters. And in that paper, it showed that when a woman receives just a couple of X-rays during pregnancy to find out the position of the baby or the size of the opening, the canal through which the baby has emerged, it turns out that she found that women who had received X-rays during pregnancy had twice the risk of developing cancer in their children, that the children before age 10 developed leukemia and cancer at twice the rate than a control group of women who had the same background and same history, same age and everything. And so we knew all of a sudden that very much less radiation is needed to damage the infant in utero. Because